Okay, good afternoon and good morning, everybody. John Holland, the Chief Development Officer of Pinchin, calling in from Vancouver, BC. I'll be your moderator on today's webinar, Legionella Issues in Buildings in the Year of COVID-19. As any of you who have attended previous webinars know, this is something we've been presenting a series of webinars on the COVID-19 issue and how it affects building occupants, building occupancy, safety in the future of how we choose to come back to buildings in the current and the post-COVID era. As we all know, many of the buildings that we occupy have been impacted by vacancy this last 4 months. With these conditions, the risk of airborne and waterborne infection for Legionella potentially increases. Schools, workplaces, and other buildings reoccupied for the fall, we're all going to be challenged to manage this issue carefully, thoughtfully, and with diligence. At Pinchin, we've been doing Legionella work for many years, and part of our mandate to our clients and our broader community is to share our experience with those people so that you and we can learn together and do this collectively better. So today's panel has been selected to discuss the issues around reoccupancy with Legionella, potential remedies and issues as we move forward. So we have 3 speakers on this subject. Next slide, please. Bit of housekeeping before I go to the introductions. First of all get comfortable clearly. Adjust your audio volume so that you can hear people in the room. A few features of the Zoom webinar. I'm sure many of you have been on these before, but the chat function is purely for people that have issues with technical access, not for questions, not for technical questions. Just if you can't get on, you can't hear, you can't see. If you'd like to raise your hands, people, we'll just make sure that the volumes are working, you can really hear us. If I could ask people on the call to raise their hands. I see one person raising their hand, that's good. And finally, the Q&A. We'd like you to put your questions in this section to post them. I'll be moderating them and I'll present them to the, I'll give them to the presenters at an appropriate time as we go through this. So thank you to all of you for your participation in this webinar, and look forward to your questions and your feedback, and above all, your ideas on future webinars as we continue to navigate this journey together. So we have 3 speakers today, and I'll introduce them briefly. The first speaker, I'm your moderator on the left, John Holland. The first speaker is Adam Crawford, who's the operations manager with our GTA Indoor Environmental Quality based in Mississauga. Adam looks after all the employees in Mississauga, Toronto, and Markham IEQ group for Pinchin. He's also our national practice specialist for Legionella at Pinchin. He holds an honours degree in environmental biology from the University of Guelph and a diploma in occupational health and safety from McMaster University. And he's also a certified industrial hygienist. Second speaker is a guest speaker from chem-aqua, a water and chemical treatment company based in Toronto. Terry has been with chem-aqua for 26 years. He's currently the senior manager of chem-aqua's environmental and healthcare division. This division is devoted to minimizing waterborne pathogens, including Legionella, through scientifically validated treatment options. And he's going to give us some examples of that at today's presentation. Terry holds a Master of Water Treatment certificate from chem-aqua. He's also a member of the CSA 3.17 Healthcare Plumbing Standards Committee. And he also has a Legionella Risk Management Certificate, actually several, from the University of Alberta. Thank you and welcome, Terry. And our final speaker is another Pinchin employee, Dr. Rafiq Dolimamode. He's the technical manager of the Environmental Microbiology Lab at Pinchin, based in Mississauga. In this position, the lab has successfully passed 3 major external audits following ISO 17025 guidelines to uphold our accredited status with the American Industrial Hygiene Association, and also for Legionella analysis. Rafiq has over 20 years of experience in academic environments before coming to Pinchin, including teaching and mycological research. He's also co-authored several publications describing new microfungal taxa. Rafiq holds a Bachelor of Science degree in Botany and Zoology from London University and a Master of Science of Pure and Applied Plant Taxonomy from Reading University, also in the UK. He completed his doctorate in mycology at the University of Mauritius for his work on tropical fungal diversity on endemic plants. Welcome and thank you, Rafiq. So with that, I'll pass the presentation over to my co-presenters, and I'll join you all at the end for Q&A. Thank you. Over to you, Adam.
Great, thank you, John. So I'm going to start us off by going through a bit of history on Legionella bacteria, routes of transmission, conditions that allow it to thrive, and some recent questions we've been getting from several of our clients. Next slide, please. So the origin of Legionnaire's disease. So the first documented outbreak occurred in 1976 in Philadelphia amongst attendees of the American Legion Convention. So attendees who were staying at the Bellevue Hotel, there were 221 cases of unusual respiratory disease, headaches, high fever, and difficulty breathing. So of these 221 cases, 35% of those cases were hospitalized, and there were 34 deaths. Ultimately, the Center for Disease Control identified a bacteria which they called Legionella pneumophila. So the Legionella after where it was discovered at this Legionnaires convention, and pneumophila is Latin for lung loving. So they isolated from the hotel cooling tower. So 1976 isn't that long ago. The bacteria didn't magically appear in 1976, but it is the first time that it was isolated. It doesn't grow well on traditional media, so it did take some investigation and trial and error before they were actually able to isolate the bacteria for the first time in 1976. Next slide, please. So what is Legionnaire's disease? It is a bacterial pneumonia. It's caused by inhalation of aerosols containing the Legionella bacteria. So kind of the progression is a disease develops within 2 to 10 days following exposure. Starts with flu-like symptoms, chest pains, high fever, and can progress to pneumonia and death. So a lot of the symptoms are very similar to COVID-19. The good news is it can be treated effectively if it's caught early. It does have a fatality rate of 10 to 15% though. Also, the good news is the Legionella infection is not contagious, so it's not going to be transmitted from person to person, such as COVID-19 is. Now, the Legionella bacteria also causes another disease known as Pontiac fever. So Pontiac fever is a Legionella infection without the pneumonia. A lot of the time, it's not even diagnosed because people who have been exposed, they develop flu-like symptoms, they think they have the flu, and they're able to get through this illness without any sort of medical intervention. So in the US annually, it's believed there are 6,000 Legionnaire's disease, or not believed, but there are about 6,000 Legionnaire's disease cases reported annually in the US. The most recent US population data estimates that there are actually 8,000 to 18,000 people hospitalized each year with Legionnaire's disease. So this would be Legionnaire's disease and Pontiac fever. But because patients with Pontiac fever usually get better on their own, these cases aren't routinely recognized or reported. But if someone is diagnosed with Legionnaire's disease, that is a reportable disease. So the doctor would have to report that to public health. Next slide, please. So the risk factors for contracting Legionnaire's disease, I mean, we should make it clear that perfectly healthy individuals can contract Legionnaire's disease if they're exposed. But like many diseases, you know, people who are immunocompromised, the elderly, current and former smokers, heavy drinkers, they are more susceptible to contracting Legionnaire's disease than perfectly healthy individuals, but there are many documented cases of perfectly healthy individuals contracting the disease following exposure. Next slide. So the route of exposure for Legionnaire's disease is inhalation of aerosol, a water aerosol containing the Legionella bacteria. So the size fraction that is most to be concerned about is in this size of 1 to 5 micrometers, and that's the aerosol size fraction that can be inhaled deeply into the lung. So to put that into perspective, a grain of sand is about 90 micrometers in diameter. Human hair is 50 to 70 micrometers in diameter. So when you're talking about this 1 to 5 micrometer range, you know, that's a really small size fraction, and that aerosol is not going to be visible to the human eye. Next slide, please. So the bacteria responsible, Legionella bacteria, now where is it found? It can be found in all surface waters such as lakes and streams. There have also been some reports of, well, it is found in soil, and there have been reports of people doing, you know, simple things such as gardening who have contracted Legionnaire's disease by disturbing significant quantities of soil. So Legionella pneumophila is one species of the family of the Legionella bacteria that is the causative species of more than 90% of reported cases. So the Legionella pneumophila also has several strains which we refer to as serogroup. So serogroup 1 is most frequently associated with Legionnaire's disease, followed by serogroups 4 and 6, which are the second and third type, third serogroups most commonly linked to Legionnaire's disease. And when we get into Rafiq's section, he'll talk about certificates of analysis and breaking down the serogroups when and if you're taking samples. Next slide, please. So the chain of transmission. So we previously said that you can find the Legionella bacteria in surface waters, streams, lakes, and things like that, and soil. So Legionnaire's disease and Pontiac fever are really kind of man-made diseases because, you know, we want to be comfortable in our work and home environments. We want, you know, we want cooling in the summer. We want humidified air in the winter. We want, you know, nice cold and hot water in our buildings. So from these natural water sources, and you know, the water may go through a treatment system, it's not 100% effective. So we bring this water into our buildings and put it in some sort of reservoir. Now this could be a hot water tank, this could be your cooling tower, this could be, you know, just think of the number of vessels you may have in your building. So if the bacteria is in the building and an aerosol is generated, and when people think about aerosol generating devices, they commonly think about cooling towers in these office buildings. So yes, cooling towers definitely produce a lot of aerosol, but you can get aerosol by some forms of humidification systems. You can get aerosols from decorative water features. Shower heads produce a water aerosol. Even faucet aerators do produce some amount of aerosol. So if you have this aerosol with the bacteria in it and someone inhales that aerosol, you know, they are exposed at that point. And if their natural immune system isn't able to combat it, then they can be infected with legionellosis, so either Legionnaire's disease or Pontiac fever. Next slide, please. So the influence of water temperature on Legionella bacteria growth. So the growth range for the bacteria, it's a fairly wide range. It's between 20 degrees Celsius and 49 degrees Celsius. Below 20 degrees Celsius, the bacteria is pretty dormant. It's a cold temperature for the bacteria. So as water temperatures increase above 49 degrees Celsius, growth slows, and then kind of as you're getting above 50, 60 into that 70 degrees Celsius range, the bacteria actually begin to die off with rapid death occurring at 70 degrees Celsius. The ideal growth range for the bacteria, though, is between 30 degrees Celsius and 42 degrees Celsius. Next slide, please. Now, another factor for how well the bacteria may colonize your systems is biofilm. So biofilm is a complex microenvironment. There are all sorts of bacteria in these biofilm. There's Legionella bacteria colonizing other amoeba and things like that and multiplying. Now, when this biofilm is disturbed, it can be a primary contributor to outbreaks. The biofilm serves to protect the bacteria from mostly chemical treatment. If you're getting a biofilm in a cooling tower, you know, that might be easily cleaned because you can get to a cooling tower and clean it. It's particularly an issue on corroded surfaces such as domestic hot and cold water systems. So, you know, hot water tanks and hot and cold water lines, they're not easily accessed for any sort of physical cleaning. And as I said, the biofilm does protect the bacteria from some chemical treatments. Next slide, please. So what we're seeing a lot of in our client sites due to low occupancy during COVID are these dead legs. So you can have two types of dead legs. you can have a line going to a, let's say, a kitchen that was removed years ago and turned into an office, but those plumbing lines weren't disconnected back to the hot or cold water riser. So that's one type. And the other type of dead leg you have is just, you know, due to low occupancy, water isn't being used in our buildings as it would typically be used. So you've got water sitting stagnant in these lines, allowing it to kind of heat up or cool down from its intended delivery temperature and resulting in conditions that are favorable for Legionella growth. Next slide, please. So a lot of the questions we've been getting from our clients recently in terms of Legionella are, you know, number one, do I have Legionella in my building? So I think if you look hard enough in your building, you may find some low concentrations of Legionella bacteria. And we're really talking about domestic systems here. You know, if you're looking down in the depths of the building and doing some testing, you may find it in low concentrations or maybe even high concentrations if you haven't been doing a kind of a regular flushing program during your periods of low occupancy. So, you know, my building's been vacant or had low occupancy due to the pandemic. What do I need to do? So on one of the next slides, we'll get into kind of some of the bodies out there who have been saying, you know, at minimum, you need to do some flushing of your building before you think about reoccupying it if the water sat stagnant in the lines for 2, 3, 4 months. Okay, so how do I flush my building? I'm not going to spend a lot of time on that. Terry's going to get into that, and he has a lot of experience with that. There's not necessarily a recipe, unfortunately. You know, flushing a 10,000 square foot office building is going to be significantly different than trying to, you know, flush something the size of a hospital or something like that. Do I need to do any testing? So, I mean, this will depend on what you've been doing in your building and if you have a Legionella management program or a water management program. If you've been doing a regular flushing and doing some testing and have never found issues, maybe you don't need to do testing, but your tenants may insist on some sort of testing just to verify that flushing was effective at removing any sort of residual bacteria. And then what criteria do I compare results to if I do testing? So the goal of all testing, whether it's a cooling tower or your, you know, shower in a locker room, is to find no Legionella bacteria above the detection limit. There are some guidelines and standards out there that assist in interpretation, but the goal should always be no detectable Legionella in your samples, regardless of the system being sampled. Next slide, please. So just on flushing guidance, so the Center for Disease Control, the American Industrial Hygiene Association, the RBQ in Quebec, and the Canadian Water and Wastewater Association, and these are just a few of the organizations who have issued recommendations about flushing a building. You know, the way to flush differs a little bit in all these documents, but the message is a flush of buildings that have had low occupancy and not a lot of water movement due to COVID-19 needs to be done before reoccupancy. Next slide, please. And just a few of the guidelines and standards available out there. So MD 15161, that's a Canadian standard. We refer to that fairly regularly because it's Canadian and it's a really good document. ASHRAE has a couple of guidelines out there. So the standard 188 released in 2018 and guideline 12 2020, which was updated in February or March of this year. The American Industrial Hygiene Association has a really good document out there. And the Cooling Technology Institute has a document for specific to cooling towers, which was kind of updated and released in March 2020 of this year, I believe. So all of these documents and others out there, we refer to on a regular basis when consulting or working on management programs. I think that's it for me.
Great, thank you, Adam. Just a reminder, next presenter is Terry. Just before Terry comes on, people want to pose questions. The Q&A on the Zoom interface is there for you to write those questions, and I'll attempt to moderate them. As we go through this, thank you. Terry, over to you.
Thank you, John. Thank you for having me. So, next slide. I'm not a doctor, and I do not play one on the internet. but here's what I can tell you about COVID-19. It has not been detected in drinking water. And if it is in the drinking water, our methods of disinfection at our plants will inactivate it. So why did they invite a water treater to talk to you? Well, pretty simple. Work from home, travel bans, they've reduced occupancies in buildings. And when you have reduced occupancy, you have reduced water flows and water usage. And when that happens, you can actually get stagnation in your building water system. Next slide. So stagnation is a water treatment problem. Here's what happens. The city sends chlorine or monochloramines to your building with your makeup water. As you use your water, the disinfectant, the water gets replaced and the disinfectant stays fresh. When we don't use the water in a certain area or at a certain section of the building, well, as we all know, chlorine dissipates very, very quickly when it's stagnant. So now I have no water sitting there that's stagnant with no disinfection in it. Water coming in is cold. Cold water, as Adam told you, has less Legionella bacteria and it's dormant. It starts to warm up to the ambient temperature. So now I've got stagnant water with no disinfection at the perfect temperature for Legionella growth. It definitely increases our risk of Legionella. It definitely increases our risk of biofilm from Legionella and other bacteria that are all growing in the water. Underneath that biofilms, you can actually get microbiologically induced corrosion, which can actually eat up your pipes. And all those corrosion byproducts are laying in the water. It can change the color of the water and it can actually cause a smell in your water. Change the slide. Next slide, please. So what should you do while your building is shut down or at low occupancy? Next slide. Well, actually, it's pretty simple. Your goal is just to replicate your normal water usage while your building was full. So start with your water heaters. Don't try to save a nickel on energy by lowering your temperature of your domestic hot water or shutting off your recirculation pipes. Maintain your temperatures and make sure you maintain your circulation. If you're not using the HVAC systems, if you don't need to, if you're not using your water feature or your ice machines, disconnect them and drain them. No water, no problem. Most buildings in this time of year do need some of that HVAC, so even when they're at low occupancy. So if you are going to run your HVAC systems, make sure you continue your water treatment program and make sure that you circulate all of the systems so that it gets some biocides. We'll talk about that in a minute. If you get nothing else from the discussion that I'll do for you today, please take this home with you. Flushing is your friend. You need to flush all the hot and cold water fixtures, including your showers, at least weekly. Oh, how often should we do it, Terry? I get that question a lot. At least once a week. And document what you've done so that you have proof that you've done it. When you're flushing your systems, it keeps the P-traps wet too, and the P-traps are designed simply to keep your sewer gases out of the building, so that helps with that as well. Next slide. So how long is long enough when it comes to flushing? There's lots of different ways to look at it, but really, again, you don't have to make it hard. You want to run the water until you get some disinfectant showing in there. The city's sending chlorine or monochloramines. You run the tap, you do a quick test, and really the strips are one of the easiest ways. Just run the strip under there. If it shows disinfection, if it shows disinfectant, changes color, you're all right. A little harder to do in hot water because chlorine dissipates faster as you warm the water up. So in hot water systems, you really want to run them until the water gets hot and then for another minute or two. And you want to make sure that the water's clean looking. If it's been sitting around a long time, it could be yellow, it could be a little smelly. You want to flush till your aesthetic quality is good. Now, if we have any engineers in the audience today, you can do all the water volume of all the piping in the building and figure out your flow rate at each individual fixture and then replace 1 to 2 volumes of water in the building. That works as well. Whatever you do, make sure that you write down that you did something. You don't have to record every single tap, but pick a few at the beginning, a couple in the middle, and some towards the end, 5 or 6 sample points, and write them down that you tested them and you showed residuals. Next slide. Couple of tips when you're doing the flushing. I've had people say, hey, can we bring everybody in and flush the whole building at one time? Don't do that. If you open too many faucets at once and showers and taps, you can actually system water, all the old, don't want to get technical, crap off of your pipes and into your water. Can cause more problems. You want to start your flush down, usually down near where the main comes in. Flush at the main with a big hose bib, make sure there is disinfection coming to your building, and then run from there. You probably want to open a tap at the far end so that the water is running in the right direction when you're doing your flushing. If the system's been stagnant and it's kind of yellow, you may want to make sure that you do hose bibs and faucets before you do electronic faucets and things with smaller diaphragms like toilets. Next. This is my favorite one because this is more for your HVAC systems. I get this all the time. Make sure your whole system is circulating. Oh yeah, Terry, everything's running. Well, I'm standing next to one chiller that is operating and the one beside me isn't circulating. Oh, well, that one comes on at 35 degrees C. Well, that's just a big old dead leg. That redundant pump, that's just a dead leg. That equalization lines, that free cooling heat exchanger over there, that reheat exchanger, all those things aren't circulating. They're all dead legs. And dead legs, biofilms form very quickly. The Legionella lives inside the biofilm. You start them up and it turns it on. So you want to make sure that you manually or use your building management system to circulate every single pump on that HVAC system. You don't have to turn the fans on, just get circulation going, and then work with your water treatment company to make sure that at that same time, they're feeding the biocide and the inhibitor so that every drop of water sees biocide at least once a week. Next slide. So what are we going to do now that we want to open our buildings that have been shut down completely? Next slide. Well, if you've been flushing all your point of uses and your tanks and your hot water heaters, you're probably ready to go. But if you haven't been doing that flushing regularly, then you're going to have to get a little bit more aggressive. If you're lucky, you can get away with just a really heavy system flush and verify that you have disinfectant at every point of use, which is going to be a little harder to do in the hot water systems because, as I say, the chlorine does dissipate quicker. Or you may have to go to a system disinfection. Different types out there, hyperchlorinization, superheat and flush. Now those sound easy to do, but they're really not. To do a hyperchlorination as per CSA, you've got to have 25 ppm of free chlorines. Hold at every faucet, hold that for 24 hours, and then flush that all out of your building so you can't use your system. And a superheat, you've got to get it up to 70 degrees C, circulate that for an hour, and then flush every tap for 5 to 10 minutes, which again, huge danger of scalding. And you might not be able to do it because of the temperatures. And there is also long-term or short-term copper silver ionization that works great for hot water systems. But remember, again, flushing is your friend. Next slide. So whichever way you're going to do it, with heavy flushing or disinfection, you got to make sure that you do every faucet, every water system, every shower in the building. And you've got to document your residuals and your temperatures and what the water looks like. If you are going to do a disinfection, you've got to make sure that you flow that disinfectant through all of those fixtures. And you're going to find that some of these smaller ones, you may have to actually take them apart and do them manually. Next slide. One of the bigger problems is flow restrictors, aerators, shower heads. It's real important that you get them done. So you either have to flow the disinfectant through them, but you're probably going to have to, if your water's got any dirt at all from laying around stagnant, you're probably going to have to take off the aerators and disinfect them manually and maybe even replace them. It might be quicker than trying to clean them. Next slide. Lots of different things we could cover, but I do want to cover eyewash stations and safety showers. Hopefully, even if your building is shut down, you are still maintaining your flow through those. But if you do a system disinfection, they have to be disinfected. But it's extremely important that you flush them with fresh water to get all that disinfectant out before you put them back into use. And next slide. So they've asked me just to go over a couple of different disinfections that we've run into when we've had Legionella counts, because there are different ways to handle it. It depends on where you are and what the situation is. So the first one was pretty easy. There's a couple of buildings actually in Toronto and different cities across Canada, and a hospital in Winnipeg that hadn't really been using some sections, and they tested them and they got a few positives, but they were all less than 10 colony forming units. So we got lucky there. It was pretty easy. We decided let's try a real heavy flushing. So we flushed each affected area for 3 days and then retested, and we got no Legionella detected, which was great. Second example, next slide, please. This one's a little bit trickier because they had a high number of samples that tested positive, and they were a lot higher in Legionella counts. Some of them were over almost at 100. Now the problem here is, so at those levels we have to do some sort of disinfection. We know we can't get away with just the flushing, but these are residential towers, and you have to disrupt the tenants if they do the heat and flush and shut down their systems for the disinfectant. So they decided that what we would do is put in a short-term copper-silver ionization system. We brought that in, we hooked that up, we ran the copper-silver ions up to where we needed them to be. Then the staff flushed all the taps every day for a week, and they got the tenants to flush their taps once or twice during the week. And when we did the retest, we found no Legionella samples, or no Legionella was detected in any of the samples. Third one, next slide, please. Now this one's a little bit different too. This was a senior living building in Ontario. Luckily, it was a small building. They had actual outbreak of Legionnaires. A couple of residents had contracted Legionnaires. Public health came in and they had actually shut the water off to this building, the hot water off, because 50% of the hot water samples were positive for Legionella, some of them quite high. Because the system was already off, we didn't have to shut it down. So we decided to do a quicker disinfection first off, which was the heat and flush. Torqued up the system to 71 degrees C, removed the brain so that we could get it to the faucets at that temperature, circulated it for an hour, and then started to flush the taps. Again, lucky it was a small building because we could only do 1 or 2 rooms at that temperature and maintain that temperature. So we would do 1 or 2 rooms, let it heat back up, do 1 or 2 rooms. And then after that disinfection, we stuck on the copper silver for long-term ionization as part of their water management plan. But we did a quick QPCR right after and pinch and showed that there was only 1 sample came back with any Legionella bacteria in it at all. And then we followed that up with the culture testing. So lots of different ways depending on where you are and how you're using the systems. And last but not least, next slide, please. Yeah, cooling towers get Legionella. Oh my God, we do thousands of Legionella tests on cooling towers all across Canada, and probably 2 to 3% of them come back with some sort of positive result. Even the best treated cooling towers can have Legionella bacteria in them. So we have to make sure that we can disinfect them. Now, cooling towers, a lot easier to disinfect than a hot water system. All the standards say pretty much the same thing. As long as we increase the chlorine to 25 ppm, circulate all the pumps with that level of chlorine for 2 hours, then flush everything back out, remove as much of the water and dead bacteria as you can so it doesn't become food for other bacteria. And I'll be honest, in the hundreds of these we've done, almost every single time it gets rid of, we come back on our retest with no Legionella detected. But the trick is with cooling towers, something usually caused the Legionella to come all of a sudden. Either the pump was broke, the pail was empty, some out of the line heat exchanger kicked in. So it's important that you identify the cause if possible and remedy that. Next slide, please. Now, I know Adam already talked about them. North America is far behind the rest of the civilized world when it comes to Legionella standards. However, we are getting better, and Canada is leading the way. RBQ, which is the building code in Quebec, is the law now. In Quebec, if you have a cooling tower, you have to register the tower, register your treatment plan, and it's mandatory that you do Legionella culture testing every 30 days. Public Works Government Services Canada is a federal standard. Again, standard, not a law in Canada, but it also matches the RBQ. You have to do all the treatments. You have to do the testing once a month while your tower is running. ASHRAE 188, it is actually updated to 218 now. It is a widely accepted standard for Legionella minimization. The CDC actually has a toolkit online to help you minimize Legionella in your buildings. CSA is the 317 is the healthcare plumbing standard. We're actually redoing it right now. It's in draft to include more Legionella minimization language in it. Next slide. But here's the key. All the standards, doesn't matter where you are, say the same thing. You need to develop a site-specific water safety plan for your building. And there's the key. It has to be site-specific. Different buildings have different types of equipment. They have different water. They have different occupants. So you need a site-specific plan for your building. It doesn't have to be hard. It doesn't have to be tricky. But what you want it to do is allow you to maintain your equipment properly while minimizing Legionella and follow the best practices. So it should define which equipment is a risk for Legionella in your building. A simple schematic, it doesn't have to be a fancy drawing, just a schematic to follow the water through your building, provide what are your startup and maintenance protocols for that susceptible equipment. And this is where you define whether you're doing Legionella testing. And if you are, what are you going to do when, not if, but when you find the Legionella is detected? Next slide, please. So last slide. Should you do Legionella testing or not in your buildings? Well, if you're in Quebec, you don't have a choice. It is the law. You have to do Legionella culture tests on your cooling towers at least every 30 days. 1516.1 mandates the same thing. Every month while your tower is running, you have to do Legionella culture tests. 1516.1 also does mandate domestic hot water twice a year if you have showers, once a year if you don't. And your decorative water features have to be tested every other month. So that's pretty easy. ASHRAE, CDC, neither one of them, while great standards and they're excellent things to do with your equipment and how to minimize Legionella, neither one of them says that you have to do Legionella testing. They do say that your water management team should consider it as a means of verifying that your water management plan is testing. But they don't actually get working, not testing, if your water management plan is actually working. But they don't actually give you how often or where or any protocols. And this is my last slide. Next slide. That was my last slide. All right. Thank you very much for having me. Appreciate it.
Thank you. Thank you, Terry. Rafiq, over to you for your presentation. Thank you very much.
Thank you, John. Next slide, please. Well, we've heard from Terry mentioning about this ASHRAE, CDC, Public Works, and RBQ mandating that we have to test and sample at a certain schedule. But here we are talking of reopening buildings after lockdown. You have done what you have to do with your buildings. You clean the water systems, you flushed, you clean the towers, you've decontaminated, and all you need now is a clean bill from the lab saying that you don't have Legionella in your system, and you can open safely your building. So all these testing and sampling is mandated, as I said, by recommendations, by guidelines, by regulations. And secondly, you also test when you rely, when you are having an outbreak of Legionnaire's disease, as we've seen in Quebec City in 2012, you have to determine the root cause of that. So you go quite very fast and go test everywhere and look for the culprit and act on it. We had cases last year in Ontario, in Orillia, in Barrie, and London, where testing has been involved to investigate outbreaks. You also rely on testing to verify if decontamination procedures you have in place are working. Next slide, please. How often are you going to sample and test? Two documents are helpful here. The Public Works MD 15161 and the Quebec RBQ regulations. They recommend for cooling towers to take a monthly sample. Every month in Quebec, it's law, you have to take a sample for a cooling tower. And normally also when you have a startup in spring, you clean up your cooling tower, you need to do a sampling and test and see whether it is clean up. And then you also test when you have high counts, you have recorded high counts, and you decontaminate, and you want to make sure that decontamination has worked properly. And lastly, you also test when you're running the system on an emergency mode at every week. Weekly tests are done on systems which are running on emergency mode. For potable water systems, we rely on MD 15161 to guide us how often to take samples. Showers and taps are usually sampled every 6 months. You know, when you flush a building, you take it after flushing. For decorative fountains, it is recommended to do it every 2 months, and humidifiers every 3 months. Next slide, please. How to send your samples to the laboratory? What are the precautions? How to sample? Use sterilized bottles, bottles which are sterile and which has the right preservative in it. Normally, it has to have a certain amount of sodium sulfate to neutralize the chlorine, which is always contained in water. So make sure that you use the right bottle. 100 milliliters are recommended for cooling towers, 500 milliliters for other types of samples. That's a minimum you should use. Once you've taken your sample, immediately put it in a cooler box with ice pack there. You know, remember, bacteria grow at temperatures, you know, as soon as temperatures started going above 20, you started having multiplication of bacteria. Legionella is a fast-growing bacterium, so you want to keep them at lower temperatures to maintain the numbers as they were when you took the sample. Put them in a cooler box, put your bottles there, and make sure that you don't put the bottles close to the ice pack. Just use some bubble wrap or shredded paper to separate them, and then send these to the lab within 48 hours. The sooner you send, the better it is. And make sure you have the proper documentation along with your samples. Next slide, please. Now, which laboratory are you going to use to send your samples? Look for a laboratory which has got some accreditation for Legionella testing. You can be confident that your samples will be handled by qualified professionals, and the laboratory has a rigorous system in place to give you a service which you can trust. Look for credentials of the lab, the certifications, whether they have accreditations with bodies which are recognized, CALA recognition, AIJ is a good accreditation to have. Or if you're operating in Quebec, it's law, you have to be accredited by the Quebec government, and make sure that these labs participate in some credible proficiency testing programs. A good one here is the CDC, the program run by the CDC, the ELITE program. And then you also look for a laboratory which is constantly in touch with its customers, which is proactive which will give you advance notice for the presence of high counts of Legionella so that you can take necessary corrective action. The sooner the better. The culture test takes 10 days, but preliminary results can be available as soon as the 5th day. Next slide, please. Analytical methods. Which methods are we going to choose? There are two laboratory methods which are used. Culturing method. The culture method is based on the ISO 11731 method. It is the most widely used worldwide, and you have variations of it. The CDC method is a variation of one of the ISO 11731, just like the AFNO method, which is used in Quebec, is also a variation. Culture method gives you counts of viable colonies of Legionella in your water. Then you have QPCR molecular method, which follows the ISO 12869 standard, which targets DNA of Legionella in the sample. And lastly, you have DIY test kits, which can be done on the site. There are many around. Just to cite a few: the Spartan Cube, Nephros Pluripath, Accepta, Legionella Fast. All these are available. These tools can be used, but they are not here to replace the third-party laboratory testing using internationally approved methods. They are not recommended in the RBQ regulations, nor are they in the MD 15161 guidelines. Which method, next slide please. Which method to choose for your samples following a lockdown? Go for the gold standard. There's no question. Culturing is the most widely used and recommended method worldwide. It identifies and quantifies viable colonies of Legionella pneumophila and its serogroups. And this is a very important piece of information which you need to manage your water, your buildings. Legionella pneumophila and serogroup 1 accounts for the over 90% of Legionnaire's disease worldwide. So go for culturing. It will give you all the information you need. It is suitable for all types of water samples, be it faucets, showers, fountains, and cooling towers. Gives you results within 7 to 10 days, but as I said, preliminary ones are available as early as the 5th day. Next one, please. When do you choose QPCR? You are monitoring a decontamination following a record of high counts of Legionella. Go for QPCR. Or when you are running your system, your cooling tower on emergency mode, or when you are investigating an outbreak and you want to narrow down your search very quickly, you have to use QPCR. It can be done within 4 hours. It's a very efficient method to detect Legionella pneumophila or Legionella species, but it doesn't detect both. It doesn't go into serogrouping or serotyping. It's a very fast method to get results. Normally labs offer the same day service if you send your samples early in the morning. QPCR gives you accounts of total DNA in genomic equivalent, right? Next slide, please. Now for this slide, I have looked at data for a COVID period, June, July 2020, and compare it with June, July 2019, which is a non-COVID period. At the start, I can tell you we have seen about 20 to 30% increase in volume of work in this COVID year, which means that, property owners, building managers are doing their due diligence. They are taking more samples to send to the lab. What do these results tell us? First of all, that the positive Legionella total detects we've seen the percentage of samples which are positive is still hovering around 12%. It was 12.1 last year, it's 12.5 this year. It's probably, this is slight increase is probably due to the fact that systems have been stagnant for 2-3 months, and then we've done sampling after that. The good thing about it, if you go to Legionella pneumophila total, last year it was 9.6% for this period. However, this year we've seen that it goes down to 7%, and it's a decrease by 1.8%, which is a very encouraging result. The pneumophila is the most virulent species amongst Legionella, and it's a good finding. And lastly, we find that the other species of Legionella have increased in their frequency from 2.5, and we've seen an increase of 2.2% there. What do these data suggest us? Why are we seeing these differences? I mean, we need to go and compare a bit more the data for cooling towers against other water systems. Remember, I said earlier on, we've had 20 to 30% more of water coming in our systems, in our lab, and a lot of it was water coming from potable water systems this year. And we have to also compare Quebec and non-Quebec samples. As you know, Quebec has had a mandatory sampling since for quite a long time, compared to the rest of Canada, where sampling has been done, you know, a bit every now and then. There's no mandatory sampling as such. So a little bit more of work for us to look at, to come to some explanations on why we are seeing these differences. But the good note about it, the frequency of positives has not changed that much. Legionella pneumophila tends to go down. Last slide, please. In summary, I'll say sample and test water systems for Legionella before reopening buildings. Go for the culture method. It gives you all the information you need to reopen safely. Use QPCR method to monitor efficacy of decontamination and when you are having an outbreak of Legionnaires disease around. Do your due diligence. Maintain and monitor building water and cooling systems to keep control of Legionella in your buildings and bring down the frequency of detecting Legionella. Thank you. That's all from me.
Great, thank you, Rafiq, and thank you to all presenters for that those 3 excellent presentations. I certainly learned something today. Thank you to all of you. A couple of questions from the audience. One global question: will we be sharing this presentation? We always get that. Yes, it will be posted on our website at some point in the near future, so you can see it there. Stay tuned. A question on biofilm buildup and deterioration of pipes and vessels, really for Terry and Adam, I think. What areas of a building or of a mechanical system are most susceptible to that kind of corrosion through biofilm? Terry or Adam?
Terry speaking.
Terry, go ahead.
Adam. All right, I'll take that one first, and Adam, you can correct me. Anywhere the water is low flow or no flow, biofilms form very, very quickly. More so in warmer water than in cold water, but anywhere in the water is not flowing, you can get biofilm buildup very quickly. In your cooling towers, if you get a biofilm, well, now your biocides and your inhibitors can't get to that water, to that metal water interface, so you'll get under deposit corrosion. And the same thing can happen in your hot water systems. You can get corrosion on your copper tubing. Adam?
I don't know that I have a whole lot more to add to that.
Okay, great, thank you. Okay, good. A question for Terry. On mapping redundant lines, you mentioned that you go into buildings and sometimes people don't know which lines operate at 35 degrees, which systems operate at different times based on, I guess, outdoor temperature, humidity, and internal situations in the building. One assumes that with this period we've been through, there'll be maybe a turnover of staff potentially and less oral knowledge of a building among the operators. How long, how much do you feel building operators know their buildings currently in terms of lines that are redundant and systems that are redundant? Is that well known, Terry, or do you find there's sometimes gaps in knowledge which would prompt managers to apply more diligence to their hunting down redundant lines? I guess the question is, yeah, go ahead.
Whenever we've done a survey for a water management plan, which is what I assume you're talking about when you're following the water, I could do a general of a building from outside of it. But when before we get started, what the first thing you do for your water management plan is put a team together. You want somebody that's got experience in doing them. You want somebody that knows your building systems. You want somebody that understands how infections work. There's a number of people that you have on your team. And between them, they can do, we can find most of the problems. We'll never find everything. And a lot of these things are hidden in the walls, but we have to assume that some of them are more risky than others. But when you have the right team and you put a little bit of effort into it, it doesn't take much to be able to do a schematic of your building and where does the water go. It doesn't have to be exact. It doesn't have to be precise. All the standards just want a general overview and schematic, so that if the guy that isn't working that day, or if the guy that knows everything isn't working that day, at least you've got your water management plan to tell you where everything goes.
Good.
Don't know if that helped, but.
Nope, that's clear. Thank you. Thank you very much. One more question on indoor vegetation and water features. Again, before all this started, there was a bit of a trend towards biophilic design and bringing the natural world into buildings for well-being and so on. Do we pick up Legionella in indoor water features or green walls? Have we ever tested that? Is it a risk?
I think it's definitely a risk. We've done, so the green walls or fountains or things like that, we've tested some and not found Legionella. We've tested others and found Legionella bacteria. They're definitely a risk. They can release some aerosol. I mean, the problem we've seen with these green walls is that it's difficult to treat the water without killing the plants. So that's one of the tricky parts of these living wall systems.
Right. Yeah. So that's kind of feedback for people that design these things, that the irrigation needs to be modified or designed to avoid that issue in terms of how it's irrigated, maybe manually perhaps.
I mean, does Terry have any experience with living walls?
Water features on the whole should, best treatment is dirt, fill them in and plant trees.
Okay.
But once we get past that, yeah, living walls, just like you said, they are a risk because they can aerosolize and they do contain, some of them can contain Legionella bacteria. And the hardest part is, because of the living wall, it is hard to treat with a lot of the regular disinfectants. So circulate, 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 clean, clean, clean.
Okay. Okay, thank you. Well, that's our time. So above all, I'd like to thank our presenters for doing these presentations and bringing their experience to the group. A big thank you to the audience for being part of our experience and part of our journey. Two things: if you have feedback on this webinar or requests for future webinars, please send them over to one of the people on the call or myself, jholland@pinchin.com. And I'd like to welcome you all to future webinars as we go through this journey together. Thank you, everybody. Have a good day. Have a safe day. And we'll see you all next time. Thank you.